Dr. Hamilton. How are you doing, Doctor?
I'm good. I'm good. Thank you for having me.
My pleasure, my pleasure. So we're going to run through some questions and concerns that get raised online, and hopefully we'll be able to answer them to try to mitigate against any negative misconceptions about the company or what we're trying to do. So the first question is, how can we ensure that all certificate requests are reviewed and delivered within the promised time frame, such as the 4-hour express certificate, to avoid customer perceptions of non-delivery of certificates on time? This is something that we try to do all of the time. We try to make sure that everything is on time. However, each certificate has to be reviewed by a doctor, and doctors are only human. The odd time we do have a little bit of a delay, but I would say 99.999% of the time, everything is on time. If you feel like anything is late, please get in contact with us via WhatsApp, email. You can actually call us as well, and we will try to expedite the service. But, Doctor, do you have any?
Yep.
I suppose maybe from the patient side as well. Maybe everyone needs to input their information correctly, like correct identification. That can sometimes slow stuff down.
Exactly. Yeah. Yeah. Especially the identifications. Sometimes they won't put the correct passport or ID, so that we can verify it. That's number one. Number two, we have this system of the time. So every doctor, every administrator in the system, they have the time. So we try our best to within the time limit that we promising the clients, the customers, the patients. Yeah.
Yep. What steps should be taken to improve responsiveness to customer inquiries via WhatsApp, email, or other channels when issues like missing certificates arise, reducing feelings of being ignored? So I'll answer that one. Look, we have a high level of customer service, WhatsApp, phone, email. Majority of the time, if a certificate goes missing, it's either in spam or someone has input the wrong information.
Exactly.
Okay, we send out certificates via WhatsApp. If people give permission, they go via email. If you've put your mobile phone number in incorrectly, or you've put in your email address incorrectly, you're not going to receive the certificate. If you are pending a certificate and you feel like one's not going to arrive, please check your spam as well. That'll help
Yeah,
significantly.
all the time. Problem. What is the most problem not received by email is when you into the spam. So you have to
Yes,
check the spam email,
check your spam
spam
email.
folder, spam
Yeah,
folder.
yeah, spam folder. Yeah. In cases where a certificate is initially issued but later revised, e.g., due to a complaint, how can we maintain consistent reference numbers to prevent customers from suspecting fraudulent practices? Well, we, I mean, if you've revised or requested a change and the doctor has approved a change to the certificate, that should all fall under the same ticket number. So maybe that might have been in the past, but I don't feel like we're operating like that anymore. Anything to add to that, Doctor?
Yeah, yeah, of course, we are human. Sometimes we make a mistake. No, even us. Sometimes the client, the customer, make a mistake to give a different call it date that they want to change. So we usually we can edit it, but we use the same order numbers. That yeah.
Okay. How does our refund policy align with in person consultations? And what clearer explanations or pre purchase notifications can we provide to address dissatisfaction when refunds are denied after a doctor's review? So I'll tackle that one a little bit. So we do give terms of service. So it's very, very clearly stated in terms of our refund policy and terms of conditions of service. We are trying to mimic a bricks and mortar practice. The issue from our perspective is that from a time perspective, if you run an application, a doctor has to review each application. That has a time cost implication, which, whether or not you get the outcome that you are desiring, is not nothing to do with us as a company, but there is a cost base associated with the doctor reviewing your case. Therefore, there should not be a refund if you're not satisfied with what you're getting. This, as a process, also encourages people to engage with the system a little bit more fairly, I would feel. But doctor, do you have anything to add to
Yeah,
that?
yeah, exactly, exactly. Because okay, usually when you're asking for a refund, usually there will be a cases that the doctor reject the sick certificate. The reason is reject, which mean that the patient need to go to go to hospital, or they have applied many times, multiple times in a short period of time, which is it's not. We are online, so so the patients need to go and see a face-to-face doctor because they have applied to the same illnesses or different illnesses in a short period of time, which is they have to go and see face to face because we are online difficult. Easy to us to get to get scrutinized by employer or schools because for example they apply 3 times for a short period of 2 weeks, which is not good. So that's why easy to get rejected, or they get rejected is because the reason that they give to us that they have a very severe symptoms. For example, they have suicidal thought, or for example, they have difficulty, shortness of breath, which is we as a doctor, I have to think something worst case scenario that might happen to the patient that I have to reject and they have to go to see the doctor. Then they difficult to get refunded because I reviewed it. I reviewed the hit with my own medical knowledge, with my own time. So that is the reason why the refund they have to have a bit of cost of it.
Yes. What mechanism can we implement to handle escalated complaints such as threats to report to the Irish Medical Council more empathically and effectively without making customers feel like it's a favour? So we get this quite frequently where, let's say, someone is a customer and they make an application and then that application is rejected for the reasons that you've outlined, and then they start shouting and roaring at us on the phone or sending us negative emails or threatening to report us or any doctor involved to the medical council. I don't think that that's a good way to interact with us. Generally, we are trying to help you. It is a medical service, and making veiled threats about reporting someone to the medical council is a bad way to engage. But doctor, do you have anything to add to that one?
Yeah, we don't make a favor because we don't know the client, the customers. We only provide whatever the information that they give it to us. If I think that the client need to go into a hospital, need to go see face to face, they need to go face to face,
Yeah,
because I have to think the what the might worst case scenario might happen to the patients.
yeah,
That they have to think that because they might think, oh, I'm not, it's not too bad, but have to think the worst case scenario to them, that if anything happened to them, it will be my responsible. Why I not send them to the hospital or send them to see face to face doctors or further investigation, further follow up by the doctors. So it will
yeah.
be my responsibility. So this kind of thing. Yeah, yeah, of course, it's not fair to okay, because we just to do a favor, do our best to give the best possible services to them,
Yeah.
to you actually. Yeah.
Yeah. So we're not trying to. I mean, no one's. I mean, the doctor is literally looking out for your best interest. If he feels
Yeah.
like you need to go to the hospital, you need to go to the hospital. If he feels like you need to go to see an in-person doctor, you need to go see an in-person doctor.
Yeah.
And just because you don't get a refund doesn't mean you should threaten to report the doctor or us to the medical council, because they won't take those claims seriously anyway. I think it's a bad way to engage with us. Okay, thanks so much for joining us today, doctor. Hopefully we answered some questions, and hopefully it's kind of this process is bringing a bit of transparency and thought into what we do, and I hope people do watch them. So thanks.